Children or anyone within the vicinity of the isolation center at Enmore are safe. Permanent Secretary in the Ministry of Health, Tennyson Springer, gave the assurance during a panel discussion on Ebola and chikungunya at the Ellerslie School last night. He says the center has been constructed according to guidelines set down by the Centers for Disease Control and has been approved by the Pan American Health Organization.
The unit is closed all around. There's a seal and there's an air cooling and treatment system included, although it's not transmitted by air. We've gone the extra mile to treat any air coming out of the unit. When we designed the unit, it was designed with the full input of PAHO, Pan American Health Organization, both local and in the Washington office.
Mr. Springer says they've also taken extra precautions to ensure that security is top priority.
The Ministry of Health has taken the decision that we are also going to add an additional security fence around the unit, and the area is well lit and we have cameras in the area, so the area is pretty secure. And if a patient is in there tomorrow, we're going to have actual manpower securing the area. There's absolutely no way the students can be affected by the unit unless you breach the security perimeter. First one, which is this, the school's fence. The second one, which is around the unit and come in and touch a patient.
He also explains the decision not to treat any other infectious diseases at the Enmore Center.
We understand that Ebola is not just the disease. The disease is Ebola plus fear. There's a major international fear going around in relation to this disease. Even in New York, people who work in units with Ebola are shunned in the supermarket, in the drugstores, on the streets. People are that fearful. So I understand the fear associated with managing this condition, but Barbados is a one-by-one country in terms of size, and this unit has to be close to something.
Environmental health specialist Ronald Chapman was one of the panelists at the discussion. He says despite speculation to the contrary, chikungunya is spread by the Aedes aegypti mosquito, and he says it is certainly not airborne. Mr. Chapman says one of the reasons for this belief is how quickly chikungunya is spread, which is due to the amount of the virus the mosquito carries in its body.
Every time it pushes its mouth parts into you, it releases a small amount of saliva. That saliva is to stop your blood from clotting so that the mosquito can feed properly. It is that saliva that contains the large amount of virus. So every time that mosquito probes you, it injects a large amount of virus, the amount of virus necessary for you to become ill.
Mr. Chapman also explains why entire households have been coming down with the virus.
Barbadians will see a mosquito and they will fly up there and clap at it. It will fly and go away and it will come back. And then they will see the mosquito down by their foot flying around. By that time, that mosquito would have landed on you and started the probing process. You might have moved your foot or something. The mosquito did not take a full blood meal, but it has already passed the virus on to you, and it goes to somebody else in the house. So we've been finding whole households coming down with signs and symptoms of chikungunya because an infected mosquito did not get a full blood meal from one person, and it flies and it nips everyone in the house.
Meantime, CARICOM leaders have ended a 3-hour special summit agreeing to a 10-point plan to deal with the outbreak of the chikungunya virus and any possible incident of the deadly Ebola virus that has killed nearly 5,000 people in West Africa. CARICOM Chairman Gaston Brown, who is also the Prime Minister of Antigua and Barbuda, says the regional leaders are emphasizing that the response to the disease must be a community effort and that no member state of CARICOM must battle the public health challenges alone. Mr. Brown told reporters the region's responses to the 2 public health challenges are being coordinated by the Trinidad-based Caribbean Public Health Agency, or CARFA. He says it has been accepted that the likelihood of penetration of the Ebola virus in the region is low based on the low level of traffic from affected areas. He added that while there have been no reported cases of the virus in the region, the 17th special meeting of regional leaders urged the strengthening of the regional public health capacity to confront the possibility of an outbreak of Ebola and any other future public health challenges. Another appeal this afternoon for business people to put strict cash handling procedures in place. It comes from Crime Prevention Officer in the Royal Barbados Police Force, Station Sergeant Stephen Griffith. He told CBC News lawmen are still seeing people counting cash at the front counters at their establishments.
I want to call out to directors, managers, supervisors to look at the cash handling policies of their particular company and their firms and ensure that their staff are following best practices and following that policy to the letter. I want to also say to those small business people who sometimes do the same thing, that they have to put a cash management policy in place. You cannot continue to treat the criminal activity because it affects not only your safety, but the safety of the customers.
Station Sergeant Griffith says business people should use the professional services to transfer cash from the premises at the end of the day. He also says there should never be predictable ways of handling cash.
In other words, you don't do the same thing the same time every day in terms of the movement of your cash. You shall not be counting money at the front desk. There should be an area where you go and do that. You install drop safes so that you do not have money available at the front desk. You should have a minimum amount of money that should be at your cash desk. You must remember, a cash register is not for the storage of cash. It's for making change.
The increased number of zero-rated items has had an impact on the level of value-added tax refunds claimed by businesses in Barbados. This is according to Andrew Brathwaite, Vice President of the Institute of Chartered Accountants of Barbados, or ICAB. He made the comment during a public forum on the topic, Reform of the Barbados Tax System, what the IMF is telling us and what we should do. It was held at the Savannah Hotel.
The experience is that we started with few exemptions and few items that were zero rated. And I guess as was predicted, we started to increase the exemptions and the zero rated items. And therefore the VAT base has now been fairly significantly eroded. That causes...
Mr. Brathwaite says it is an area that the IMF has addressed in its assessment of Barbados' tax system.
Because there's so many tax filings or tax returns that include zero-rated items or items at a lower rate of VAT, this increases the proportion of refunds that companies may claim. So as opposed to if they were paying the full rate of VAT on all their revenue, the level of refunds would have been less. So there's no denying that we have significant problems now with refunds, and that the IMF is saying is because there's so many zero-rated items, zero-rated industries, exempt industries and items, etc.